Okay, well, good morning. I heard Dr. Lefkove, and I think I heard Dr. Lovett on the call. It is 10 o'clock. We're going to start right on time because we have a lot going on today. We have, this is our first of two town halls. We do have one following this one for our virtual learners, just around virtual learning in general. So we want to make sure that we are able to, finish this town hall and be able to get to another one that will start directly at 11 o'clock. So I want to welcome everyone. If hopefully my volume is okay. Sometimes when I host a big Zoom call, it gets a little bit choppy. But I'm not going to be talking the whole time, which is probably a good thing anyways. But I do want to welcome you, and I want to say thank you for being here. The time has come to have our surveillance testing town hall. We're going to talk for a little bit today with some experts around surveillance testing. So we definitely have some truly special guests. With Dr. Katika Lovett, who is the Assistant Superintendent over Student Services in Atlanta Public Schools, and she'll talk to us just in a little bit around some resources for surveillance testing. We have Dr. Ben Lefkove on the call as well, who is the founder of Viral Solutions as well as their lead physician. And then we have our two phenomenal nurses who really don't need any introduction. But I will tell you the work that these two nurses have been doing has been incredible. We are so lucky to have two full-time nurses like Nurse Lori Oxman and Brandy Ford, who are also on the call and are going to talk a little bit today about the student experience and really just how it looks at Morris Brandon. I want to remind you just a couple things. We're not going to come off mute for any questions. So if you do have any particular questions, you feel free to type them in the chat box. Our nurses will monitor it as well as Dr. Lovett. And also, yeah, we'll just get started because we have till about 10:45, and I want to make sure that we answer your questions. The reason why we are doing this, one is Morris Brandon, as you may or may not know, was one of the 8 pilot schools for surveillance testing in Atlanta Public Schools. We were actually, I believe, the first school that we actually had the Viral Solutions team set foot in. You know, we learned a whole lot about how to test a large school like Morris Brandon. We have 650 students back in person, 300 and 350 in both of our buildings. And I was happy to say that yesterday we tested close to 350 Morris Brandon students and staff. So I do think it's important for our families and community to know what is happening and why we are doing this. And many people know and trust it, but also some people have some questions. So that's why we're here as well. So without further ado, I'm going to get started. I did introduce the surveillance team so far, but I just want our families to know sort of who's running the show every Tuesday. And just so you know, Nurse Ford, who is on the call, does manage all of the primary center testing and the logistics. And she is an APS staff member who was with our students and really providing awesome social emotional support during all of this. And then I'm also at the primary center. I'm an admin that is there to help support as needed. But we have one testing team, and that is generally facilitated by Nurse Ford. At the main campus as well, Nurse Lori Oxman is our lead. She is the head. She's worked on the schedule and pulls the kids and has our surveillance cards ready for them all. So we thank her for that. And then also we have Miss Small, who is on the call as well, who helps to assist. So we have one full-time nurse and one full-time admin supporting our surveillance testing. I'm going to hand it over to Miss Small for a second, who's going to just talk for a minute about the consent form and a little bit around when you can withdraw or consent for surveillance testing, as well as the privacy that went home with all of our families. So Miss Small, take it away for me.
Good morning, everyone. So I'm going to talk about the consent forms. Consent forms are required for all students and staff to participate. The forms are kept on file here at school. They are in effect for the 2020-2021 school year. Some of the information included on the consent form is the child's last name, first name, date of birth, their school, and then of course the signature of the parent with the date. All the information from the consent forms that I just mentioned is included on the surveillance card. So that way when we do the testing, the child just hands the card to the person administering the test, and the information is conveyed quickly. As Jay mentioned, consent can be granted or withdrawn at any time throughout the school year. So if you didn't consent to testing already and you want to test, we have forms available. You can get those from our Morris Brandon website. You can get them from the B-mail. We also have extra copies printed out in the main office at each campus. So if you have your child being tested and you decide you don't want your child to be tested, you just reach out to the school nurse to let the school nurse know. And we have their email addresses included on the last slide. Also included with the consent form is the notice of privacy for COVID testing, which accompanies the form. And that just grants permission for the testing results to be shared with APS, the school, and of course with you once we have the results, and to do any contact tracing if necessary, if that needs to happen. So just once again, consent forms are very easy. They're easily accessible. You can get them from the website, the B Miller main office, and we keep them on file here at school.
All right. Awesome. Thank you so much, Ms. Small. Without further ado, I do want to introduce Dr. Lefkove, who is the founder of Viral Solutions and the lead physician. You've probably heard his name several times. You've probably heard him talk at board meetings. Maybe you've seen some instructional videos that we're going to go over in just a minute. But yesterday we tested, like I said, close to 350 students and staff using the antigen test that is below. And since I am not a doctor, I will not speak on it, but I definitely want Ben to talk a little bit about the antigen test that is given and any other information that he may have. So Ben, take it away. Thanks for being here.
Thanks for having me. Can you all hear me okay?
Yep.
Okay, excellent. Just making sure. So it's been our pleasure to serve APS and work with y'all on what I think is a very important program. Doing public health screening in the public school systems or for any large group that is going to be reconvening after the extended quarantines that we've had. It's just something that makes sense, and it needs to be viewed as an added layer of protection. So what we're trying to do here is different than what you would do in diagnostic medicine. So we're not trying to find out if you have COVID. We're trying to prevent your neighbor from catching COVID. Okay, so it's a different view. It needs to have a holistic and a community viewpoint. And it's less about what is my individual status and what is the status of the community. Okay, and so that's really what the purpose of this program is. And this is what we're doing here is similar and really modeled after what's been done successfully in the Asia Pacific region, which has had very good control of COVID in places like Singapore and Taiwan and South Korea. And they really leveraged extensive community-based testing and frequent testing. So the cadence of testing is very important, and the breadth of testing is very important. So the tests we're using right now are the Abbott Binax Now cards. You may have read about these in the media before. The government spent about $140 billion on them and distributed them out to the states to use in schools and other places for testing. And so it's a perfect application for these cards. And the great thing is we get them free of cost from the government, so we can pass that saving on to the school as well, which is wonderful. They are a very well-designed platform, and there's not really a first and second generation for rapid antigen tests, but these are a more accurate version of the rapid antigen test. Hold on a second. The way these tests work is they're a small piece of paper, and you can see that there on the bottom right, and they're just embedded inside of this card, and they have proteins embedded in them that match up with the protein shell around the COVID-19 virus. And so this test is not incredibly sensitive, so it's really only going to catch people who are quite contagious or have a significant viral load in their system right now. But a positive is generally considered a true positive. There's very few false positives. We've done tons of testing in the schools now, and we have a very low positivity rate, and that tells us tells us about the sensitivity, but also we also have a low false positive rate as well. And so these tests have been looked at across multiple populations. They've just did a big study in England on them. And there's definitely some media out there about it, which some of y'all who are in touch are very attuned to the various developments and testing platforms. I'm happy to address and discuss any questions that come up about those. But what makes this testing platform so powerful is that it's the rapidity of results and the repeatability of it. So the fact that we don't have to wait a day or 2 days to get a result on a patient is what saves us from having spreading infection, is where the power comes in, and that we can immediately remove an individual from the population to keep them from spreading it. Okay, so we can immediately do source quarantine and isolation. The other important part is that this is really looking for people who are contagious. It's not looking for people who are not contagious. So in a diagnostic test, like the PCR test, you're going to catch people who are both contagious and not contagious with the virus. Because the virus stays positive in your system for many weeks, you will see a positive PCR test for many weeks, and we do after someone has COVID. This is looking for that short period of time, and it's about 5 days or so when someone is really maximally contagious. And those are the people we want to pull out and keep from spreading it in the school. And it's not perfect, and it may even miss a few. But the point is that the better is the enemy of the good in this case. And that just applying this is just another tool. Just like this mask is not perfect at filtering COVID-19, it's effective to its level. And that's what we really have to come into tune with. The kids so far have done incredible with this. Yesterday at Brandon, I don't think there was definitely no tears, and the kids were great. They hop in the chair, bing, bang, boom, they jump out, grab their sticker, they're off, they're laughing. I thought it was really well received, and this is their third time through now, and they've done a great job on it, and it doesn't really disrupt the day, and they've really received it well. The staff have liked it too, and I think it just gives you another level of comfort that your class has been tested, that there's not at least significant amounts of infection in your class. And it enables us to have the resources now. We're already present, we're already coming to school. If there's an outbreak, we can apply a lot of testing pressure, right? If we get an outbreak in the school, we can come in and test everybody every day if we need to, right? So there is the ability for us to rapidly respond to outbreaks in the school also. So I think what APS is doing is very cutting edge and forward thinking. I'm really proud of the APS leadership for considering this program and trying it. And my hope is that we will have the best results out of any of the school systems in the city.
All right, well, that's awesome information, Dr. Lefkove. Thank you for jumping on and talking on that. I can't imagine how incredibly busy you are, because you gave a lot of good information. So thank you. If we do have any questions that pop up in the chat box, if we don't mind, just take a look at that and see. We do have one question, Ben, and I'll read it to you. Why isn't the rapid antigen test available through the regular Viral Solutions site on Northside? That's just a question that popped up. I don't know if you want to answer that.
Sure. There's two reasons for that. One is a pragmatic reason, and one is a medical reason. All right. The people coming to our tent at Viral Solutions are people who are seeking diagnosis of COVID-19, or they're coming for like travel reasons or something like that. If you're traveling, a rapid antigen test is not an appropriate test because no state agencies will accept it. So we'll leave that off. Let's say you're coming there because you were exposed, you are feeling sick, or you have symptoms in any way, or you're concerned you have COVID, then the PCR test is what makes the most sense. That test is more sensitive, and that's going to give us a more accurate diagnostic picture of what's going on. It will capture your infection, whether you're in the first day or the 30th day after your infection. The antigen test will only remain positive for a brief amount of time. Now, there probably is a use. If you come in feeling sick, you've been exposed, you have a good story, we get an antigen test, it's positive, you're done, right? So the other reason we don't do it is that because you have a 15-minute delay on it, it's just another process we would have to introduce into the workflow in the tents. And it would, we have to balance the large demand for testing with process and throughput. And we don't really want to get into a situation where we have to limit testing for individuals because, or cause prolonged delays. I don't know if any of y'all visited us around Christmas, but you saw what happened. And so, we want to take kind of every step to make sure that everybody can get in and get their test. And so we have a really fast process with PCR. So we never ended up introducing it in the tent. It's not because it wouldn't work. It's just, I don't think it would work for that environment. And there are tents that do it, but it's just been kind of a medical and a business decision that we made in the tents.
Awesome. I had one more question because you did touch upon this that had to do with what percentage of the time, if you know, does a positive test or antigen test result in a positive PCR?
So we want to definitely do, so I want to check APS on that, right? I want to do my own study on that, mini study on that. And we may end up even publishing data off of what we do at APS. And so we're working with the school to amend our agreement so that we can actually do on-site saliva collection for confirmatory PCR. And so that's still kind of pending, but we have all of that lined up. And so hopefully soon, fingers crossed, we'll be able to launch with on-site saliva collection. And so we'll be able to, if a kid turns positive, we can just have them come back, spit into the tube, we'll send it to the lab, and we'll have a result the next day. And that way we can manage the result too. So we can do that our own correlation. The problem now is that people are going all over the place to get their confirmatory PCR. And so we're going to try to tighten that up in the future. And we should have that reconciled pretty quickly. Now, when you look at the studies that have been done on it, so you have to look at, so what percentage of the time does a rapid antigen test correlate with a positive PCR test? Well, then you have to look at the positive percent agreement, right? And these tests have a pretty good positive percent agreement. I can't rattle it off for the Binax now off the top of my head. But I will tell you that the specificity of this test, which is when you look at the percent of positives over true positives in the population, is very high. It's in the high 90s%, at least based on the studies that were done for the emergency use authorization for this test. Now, with that being said, false positives do occur. We even had a false positive at one of the APS schools, and that'll happen, right? The difference, you know, the issue there is usually going to be some human error in that, like if there's a faint line or something like that, and we're maybe overreading it or overcalling it. But of course, we always want to err when you're dealing with, you know, a spreading pandemic. We want to err on the side of caution with this. And you know, with this all screening tests, you want to over screen rather than under screen. So you want to make sure you do find that happy medium. We don't want to be shutting down classes unnecessarily. But we want to, if we're going to have to err on one side, we want to err on the side of actually more positives than less positives. But you know, the data that was published on these tests show that that the positive correlation is pretty high.
Awesome. And then we had one more question that had to do with sharing results, and I can actually let Dr. Lovett touch upon that in maybe just one or two screens, because we'll talk about our reporting dashboard and so forth, if you'd like. So let's keep moving. I do want Nurse Oxman to talk just for a minute, a little bit around the process, the time, and the experience, as well as the schedule of how it looks at Morris Brandon. So this is going to be very specific to our students. While all students in APS are given the availability to do surveillance testing, many of this is very similar across schools. But I do want our families to just know around when their childs are pulled out of class, how long they're out of class for, and then what days and times that looks like. So I'm going to hand it over to Nurse Oxman for just a minute. And again, if you have any questions, you can type them in the chat box, and we'll either ask them out loud or somebody can type an answer for you.
Great. Thank you, Mr. Bland. First of all, these children are amazing. So thank you so much, parents, for one, supporting this surveillance testing effort, but also having such wonderful children. So we just started yesterday at the main campus. And so primary campus has been a few weeks. So I think that the process probably at the primary campus is a little bit better tuned at the MC location, but I think we did a really good job yesterday, and the administrators really did a fantastic job with really putting that all together kind of in a last minute situation as well. So basically there's a schedule, and my understanding is moving forward on every Tuesday, we'll start at the primary campus, and then we're going to move to the main campus, and that seemed to work out pretty well yesterday with the one team from Viral Solutions. So we will be, as soon as we get the permission slip or the consent form from the parent, we generate the little plastic green card, looks like a little credit card. I don't actually have one with me at the moment, but it has the student's name, birthday, and ID, which is the information that Viral Solutions needs to, trace the student to the test. So those cards are given to the teachers. So when we come to the classroom, the teachers hand out their green cards to the students that are participating that all have the consent. If they receive a consent that morning, we just take that paper and then we'll replace it the following week with a green card. They come down to the test site. So so far at the main campus, we have two locations that are set up, one in one part of the building, the other part of the building. So we start on one side of the building in one location. We bring the classes down. The students are social distance while they're waiting in line, and it goes very smoothly. Viral Solutions comes out. They look at the child's green card. They put the information on their little test kit. They go in. I think by the end of the day yesterday, we were having 2 kids being tested at one time, which really sped the process up really well. If staff are coming in the middle to get tested, we kind of bump them up in the front of the line, let them go a little bit quicker. And that's kind of fun for the kids also to see their teachers and other staff members on campus getting tested. So it's a real community event. And we talk to the kids about, hey, they're doing a great job, a lot of positive reinforcement. A lot of kids ask questions if they hadn't done it before. Some of the kids have done the more, the higher up in the nose procedure, and we reassure them that that's not the situation. But we do tell them it might be tickle a little bit, they might sneeze, but we're going to be there to support them throughout the process. Literally from the time the child actually is getting the test is less than a minute. The longer time might be just kind of waiting the line depending upon how many students in that class have chosen to participate. But it's really running smoothly, and then the students go right back to class. So there's very little time out of the classroom. And our goal obviously is to just kind of perfect that and speed up that process the best that we can. Viral Solutions is fabulous. They're running the tests as they're doing the tests. That doesn't mean that we're getting the results immediately, but there's a break in the day where we're moving from one location to another. And so during that break period, they're kind of catching up on the testing. And so they can give us any results of positives that they have identified at that time. And so then we can immediately react to any kind of positive that we do receive. And, we're going to be very sensitive. We're going to obviously call the parent. And really the plan would be to call into the classroom as if we were doing any other type of early dismissal, and just having, the teachers please to send the child down to the office with their things for early dismissal. And that's kind of would be the process that we would use. When the child does come down, we would put them in our care room because we know we do have a child there that would be a positive COVID case. So we'll put them in the care room, which is that room that we've set aside to isolate anyone who has the signs and symptoms, but also that we, in this case, know have tested positive. And they'd be monitored there until the parent was able to come pick them up. So once again, I want to reiterate how important it is and essential. Please, parents, make sure that all of your contact information is up to date. And if you do see a phone call coming from the school, if you can't pick it up immediately, we will definitely leave you a voicemail. So please call us back as soon as possible. That piece is really, really essential. And then after all of that, we would start our case investigation process. Ideally, we would like to have all that done before the end of the day. Realistically, particularly at the main campus, depending upon by the time Viral Solutions finishes up all their testing and have all the test results in, obviously our main focus is going to be following up on anyone who tests positive, and then we'll move into that case investigation process. So, we've been able to move very quickly on that, and the notifications would go out appropriately, either to the classroom, or if it's a staff member, we'll send it out depending upon where that staff member works in the school. If it's a teacher, we would obviously send out notification to the classroom, but we also send out notification to our general staff if it's somebody who's not having contact with students, but might have contact with other staff members. So that's kind of pretty much the process. And like I said, we're hoping that as we move along next week, we're just going to continue to improve that process.
Awesome. Thank you so much. And I have to say that I have a kindergartner, as you may or may not know. So I am I happen to always be on the kindergarten hallway when they're at surveillance testing. And the way that the Viral Solutions team handles them is phenomenal. They're so good with kids, especially the youngest ones. They give out stickers after every test, and the kids are starting to collect them now on the back of their surveillance card. So you can see how many times they've actually had the test, which is pretty cool. So just a shout out to that team because they are doing, they're very, very good with our youngest kids. Okay, I want to hand it over now to Dr. Lovett, who is our Assistant Superintendent over Student Services, and one of the main reasons why we do have surveillance testing within APS and within our school. She's going to talk just for a second around some of the resources that APS has put out, and I did link some of the videos, Dr. Lovett, and I'm happy to show the actual demonstration of the video. It's about a minute and 30 seconds if you would like, but I'll just hand it over to you so you could just talk for a minute about some of our resources that APS has.
Okay. All right. And good morning. And thank you for the opportunity to share today. I always get very excited to talk about surveillance testing because it is such an important part of our mitigation strategies and just another way in which we can show and continue to just give that reassurance around the safety of our schools and our offices. So here we have just some resources that we've put together around surveillance testing and really around surveillance testing as it relates to our comprehensive testing strategy. So we're going to go ahead and just show the video to get started. And this just demonstrates surveillance testing. I happened to be in a school one day and actually had an opportunity to get this done at Dobbs Elementary School in our school-based health clinic. So you can show the video. I don't know if the sound is on. I think we. Jay, I don't know if everybody can hear the sound.
Yeah, we can't hear the sound.
Oh, and you're on mute too.
Hey, maybe because you're muted.
Be it. Let's try it again.
Yeah, when you go to share, make sure you hit the box to do the same.
Could you hear it now?
Yes.
We can hear it now.
My bad. I've been doing this long enough. I should know to hit unmute.
Hey, my name is Ron Sanders. I'm a physician assistant. I'm also one of the co-founders for Viral Solutions. I'm here to show you how the test is performed. This is the actual swab that we use to collect the specimen. This is the tube that we put the specimen in, and this is the cap. The cartridge is similar to a pregnancy test. This is how we actually get the result. First, we start by uncapping. Entire Viral Solutions team will be in PPE, have proper face shields. And then we just do 3 swirls in each nostril. Left nostril, 1, 2, 3. Right nostril, 1, 2, 3. That's it. Go into the tube, few squeezes, swirl, squeeze, swirl. Cap goes on right after. Then we put on the cartridge, 3 drops, 1, 2, 3. That's it, the results are in 10 minutes.
All right. And thank you for sharing that. I know that we have now switched to the Binex Now card that Dr. Lefkove shared. So it's a little bit different in terms of what that administration looks like, but ultimately the same type of swab administration, not a whole lot of discomfort really at all in terms of what that looks like. So very comfortable there. We were very, in the process, we wanted to make sure we had a comfortable test. That was important to us. We're testing children, we're testing adults. We wanted something that's comfortable because we know we'd be repeating the test on a weekly basis. So you had an opportunity to see one of our demonstration videos, but here are some of the resources that are available on our district's website. So we have a video that's there where Dr. Ben Lefkove is explaining more about their surveillance testing and more about Viral Solutions. That is also available on our district website for you to review. So you're welcome to go and check that out. I don't know if we're going to play that 1 minute, Jay, but we can definitely link that as a resource for you to check out. And also some information regarding our comprehensive testing strategy. If you don't mind just clicking on that, if it's a live link. Just want to point out a few things here. Now, as I mentioned to start, the surveillance testing is just one piece of the comprehensive strategy that the district has put together.
I'll let you talk.
Yeah, I'll talk about it. I thought that was the website. So
Oh, no,
please make sure you check out the video. But basically, the comprehensive testing strategy just talks about the availability of resources here in the district. So we have both the surveillance testing as well as testing opportunities for individuals who may be otherwise symptomatic. Now, you heard Ben Lefkove talk about the one of the drive-through tents, the one at Northside, but we're also getting ready to launch an option at Douglas High School, and Viral Solutions is our partner in that work as well. So we're going to continue offering more resources for testing. I want to just put that out there. The notion around getting a surveillance test and having a positive, and then maybe going for a PCR test, we're going to have that linkage ready to go. So it'll be really easy to continue in that process. So that's an additional resource that's available. And finally, on our website, we do have some frequently asked questions. If you need more information, if you're looking for just some additional insight around surveillance testing, all of that is available on our district website that's here in front of you. How we collect samples, when are the results delivered, all of that information is there and available for you to access. So this just talks about what it looks like. You've heard our wonderful nurses talk about what it looks like there at Brandon. Finally, the weekly case reports. I know there was a question about reporting, and I just want to share a bit more about our weekly case reports. The district has recently redesigned our COVID-19 reporting dashboard, and that dashboard allows us to report out on positive cases for every building, every district office on a weekly basis. And it actually shows both positive cases as well as exposures associated with the positive cases. And you will see, looking at the information, it is a snapshot of a week. Now we're working to further build out that dashboard to include a breakdown that includes surveillance testing. As you're currently looking at it, the positives from surveillance are simply rolled into the numbers because, as Dr. Lefkove shared, we treat a positive from a surveillance test as a positive. We report it as a positive for the Department of Public Health, and we treat it as a positive for all intents and purposes. However, we have had some questions about, hey, we want to be able to track what does surveillance testing look like in the schools. And so that's important to many people for many reasons. It's equally important to us as we're tracking outbreaks and things of that nature. So that information is forthcoming as well, all of which I've shared as this information that's available to you as resources to help in tracking cases within our schools. And again, the surveillance testing is just an additional mitigation strategy to ensure the safety as we continue in the in-person learning environment. Okay, thank you.
Awesome. Thank you so much, Dr. Lovett. So just to piggyback, and I just want to let everybody know, we had a question on here, actually, Nurse Oxman. I'm gonna hand it to you really quickly. If you're able to tell us one more time, just really quickly, what happens if a student or staff member does test positive. We also had a question that have we had any positives thus far? So I would definitely refer you to our weekly case report for those answers. I know it's a little small right here, but the website is live and you can find the link to get those answers. As well as Nurse Oxman, if you don't mind, maybe just touching upon very quickly the participation rate at each building, meaning maybe do you know off the top of your head how many K1, 2 and how many 3, 4, 5 that we do have?
Oh, okay. I don't have that information off the top of my head in regards to the numbers in each grade level, but I think we were, after yesterday, we were kind of around 50%, Mr. Bland. Does that sound about right to you based upon both
we
campuses?
are 50% overall. I know we have the chart of how many kids in each class, but I took that off so we weren't that granular on how many kids, but I want to say that we have, well, I don't want to make any suggestions. So if you know the total numbers, you can. Otherwise, we could definitely publish that when we get it.
Yeah, I know at the main campus, basically, I know that we have collected about 140 student consent forms. Now, that doesn't mean that every one of those were tested the other day because some of those students were out. We did not have any students at the main campus yesterday that declined at the last moment to be tested, which was really fabulous. But back to your question regarding the number of positives. So I just want to clarify two things. So the dashboard that Dr. Lovett was referring to that Mr. Bland had up there, I, at the end of the week, have to report to APS any positive cases of staff and students. Now, that does not necessarily mean they were all identified in our surveillance testing. So, but with that said and done, if there's a positive test identified in our surveillance testing, that will be reflected as a positive on our weekly report to APS. And so we submit that information every Friday by 3 p.m. And then, as Dr. Lovett explained, that kind of gets updated. We're getting better at updating that pretty quickly as well. So that's kind of a new tool that we've been using, and the nurses are getting better at making sure that we're putting in the correct information. So you will see that. We have had one positive test result from the surveillance testing. And so I think there was another a question about what is the protocol if a student does test positive. So go back to what I had said before, we'll get those results by the end of the day, just kind of depending upon when that student was tested and when Viral Solutions gives us that information. And by the time they leave, we have that information. So sometimes we have it earlier, depending upon how they're, doing the testing and how quickly they're getting the testing done. That doesn't mean that as soon as a student returns to the classroom after they were tested that they're going to get called immediately. We're going to be sensitive and discreet, but also we want to be timely in our response to the positive. But we would obviously be contacting the parent. We would ask the teacher to send the student down to the office for early dismissal. Now we'll know who that student is, so what we'll be looking for them when they come to the office, and then we'll escort them and monitor them in the care room until the parent is picked up. So we kind of have come up with a plan as to how, you know, that's going to work, where we're minimizing stress on the students in the classroom. We're kind of handling it as if your child was getting picked up because they had a dentist appointment. You know, where the language we're using is, you know, your child is, you know, going to be going home for early dismissal. And that way, you know, it's not stressful to the students, and it seems like it's just kind of a regular thing. And it's not immediately after the class is returned from testing, so that particularly our older kids who are probably a little bit more in tune to that, you know, would maybe pick up, oh, maybe they're, you know, a problem with the test results. So that's kind of how we're handling it here. And it seems to be working okay so far. Like I said, we've only had one positive case
And I
identified.
have to emphasize that, you know, the social emotional learning part, like that is so big for us. We want to make sure that nobody is scared to surveillance test because they're scared of the results. And, you know, Dr. Lefkove said that it's not so much about the individual, but about the community and buying in, so we can stay open and we can be the best that we can be for our students. So I just have to tell you that that is number one on my plate. We tell our teachers right now, the number one focus is safety and mitigation. Number two is social and emotional learning, followed closely by instruction at number three. So there are things that we are focusing on very heavily. So if a child is a positive, you know, we're going to do everything we can to make them feel comfortable and safe and, you know, and welcoming when they're ready to come back as well. So just really quickly, Nurse Oxman follows up with the parents with DPH and CDC guidelines. I will get the letters going. So I generally will send a letter to close contacts or students that were within 6 feet of that child for a cumulative 15 minutes during the day. And I work very closely with the teacher, and even the parent and the bus drivers. We've had to go back to the bus to look at that to see if students need to get those close contact letters. If they are a close contact, then they are required to quarantine as well for at least 7 full days after the exposure, and they can return after on that 7th day. Am I correct, Nurse Oxman, with a negative test?
So we kind of have to look at that on a very individual basis, but yeah, we send out the Department of Health guidelines Department of Health recommends a 14-day quarantine, but there are criteria that could be met to shorten that quarantine. So it really just kind of is individualized and depends. So we will reach out. So the nurses, once we do that case investigation process with you know, Principal Bland and the teacher, and we identify, and the bus drivers, and we identify any of those close contacts, Mr. Bland, you know, sends out the letters, and then the nurses follow up individually with each family. And we kind of, you know, depending upon when that particular child may have been exposed, sometimes that exposure date might be different. It all just depends. Each situation is very individualized. And so we just kind of follow up with the Department of Health guidelines, and we follow up with the families individually, so that each family kind of knows what, you know, what the criteria is.
Awesome.
Hope that answered the question.
And then the last question, and maybe Dr. Lovett, I could just have you chime in on that. Can you talk for a minute around like if a child tests positive, does the class have to close? And can you talk about maybe what that means if there's more than one positive that are linked together?
Yeah, so very similar to what Nurse Oxman was sharing. Really, the case investigation is what determines whether or not the class closes. Ultimately, the results of that investigation will help us determine who was in close contact. So if it's determined that, you know, several persons were in close contact, or if it's determined that we really can't, you know, figure out who was in close contact, or we're not quite sure who met that 15-minute threshold, we always default to that as a safety measure. We will say more than likely people were in close contact, and in that case, it may mean that a particular class of students may have to close. But that really all is predicated on the results of the case investigation. That's the most critical piece that we have to remember. Just because one student is positive does not automatically mean that a class has to close. It's the case investigation that determines the outcome of what happens next in that case.
Exactly. Then we did have an instance where we did case investigation. We found some close contacts who went home, they quarantined, they came back. The whole class did not have to shut down, and we didn't see any further spread or anything after that as well. So the goal is to keep our classes and our school open. You know, that's the goal. So well, we are nearing the end of our time. So I do want to just show you a little bit more support that we have. You can reach out to our nurses here. I did create an FAQ just for our school. It is not meant to replace the APS FAQ, but if you have questions just around how surveillance testing looks at Brandon, the day, the time, that sort of thing, I have a link to that as well. But outside of that, we had one question that said, with warmer weather coming out, are we looking at doing surveillance testing outdoors? I have not heard that yet. I don't think there's a plan for that. I don't know, Dr. Lovett, if you wanted to chime in on anything like that, but I believe right now the plan would still be to stick with our indoor surveillance testing.
Yeah, and I saw Dr. Lefkove come off mute. I'll let you talk about then the benefits or difference, or if it's even necessary. But I'll tell you, we haven't planned that, but I'll let Dr. Lefkove.
Yeah, I want to address that because I noticed that there was some chatter online about that too. A screenshot from some Facebook group, I don't even know which group, was sent to me that there's concern among parents about this too. So I'm glad that it was brought up. So swabbing in and of itself, either nasopharyngeal, which is the deeper swab, or nasal swabbing, is not in itself considered an aerosol generating procedure. So the act of swabbing does not generate aerosols, okay? And so the aerosols are what we're concerned about. You aerosolize, if someone's COVID positive and they aerosolize it out into the environment, individuals come into that, inhale it, and then potentially become infected, right? So what is aerosol generating procedures are things like, positive pressure ventilation masks, nebulizer treatments, manipulation of people's airways, things like that, right? So this is not an aerosol generating procedure. It will not fill the room with a plume of COVID. Now, the concern is, well, one person asked, why does Viral Solutions then wear high level PPE, protective equipment, when they're swabbing? Well, that's because when you swab, you should be in high level equipment because you're face to face with someone and they could sneeze or cough directly in your face. While there is mounting evidence that there is some level of airborne spread of COVID-19, the predominant opinion is that it's mostly large droplet, okay? Now, that being said, ventilation is really important. All of that's really important. We know that outside's better than inside in general, right? But school is an indoor environment. And these kids are all coming from a class where they were indoors together with masks. And the brief act of taking your mask, pulling it down, sticking a swab in the front of your nose and pulling it back up is not going to generate significant aerosols in our opinion. Now, if a kid sneezes or coughs, certainly that's a possibility, but a kid can sneeze and cough even when we're not swabbing them too. And they do all through the day. I've had them, one in the hall prior to even coming into the room, sneezed, right? And so I think, again, we have to balance what is feasible with what is, best, right? So the best would be, of course, we would all be outside, the whole school would be outside, right? And no one would be indoors and the risk of infection would plummet, but we can't have school outdoors all the time. And likewise, it's not reasonable, certainly in 40 degrees or 30 degrees, to ask the kids to all go outside to do this. And the staff would have a hard time even accomplishing it in the cold. And so I think, again, the better is the enemy of the good. In this case, we can take as much measures as we can to mitigate any spread within that environment. But certainly you don't need like a negative pressure room or anything like that to perform a COVID swab, and definitely not something on the front of someone's nose like that. So, but it's a good question that they're bringing up.
All right. Well, that is great feedback. I want to say that it is 10:43, so we have 2 more minutes. I want to end right at 10:45. But I have one more question. If the student with the positive surveillance test receives a negative PCR, and I think you did address this earlier with in regard to how sensitive the antigen test is, does quarantine change? But maybe you can just talk quickly on that.
The timing of that PCR is really important. So if that PCR is delayed by a significant period of time, and I would give it even more than like 12 to 24 hours, that could call into question, the positivity of the antigen. And also there's other variables with that. How good was the collection on the PCR, right? A lot of the false negatives you see on PCR are due to poor collection technique. And so it really depends if the person obtaining that PCR got a good swab, right? So a lot of the public health sites were doing self-swab. It's hard to know if people are able to get a good collection on themselves or not. That's why at Viral Solutions, we do all of the swabbing on patients. And so it's important that the swab itself is good quality. And of course, you're using different labs and different platforms. You just have to make sure that, there's a lot of variables in that. But I would say in general, let's presume a good swab, a good technique, got a good collection, we got a positive antigen, and immediately after, when we do the saliva, this will really help with that. immediately after you're collecting a PCR result, or same day you're collecting a PCR test and it results as negative, it was probably a false positive antigen.
Can I just follow up on that? Thank you so much. But I want to just say too, from an APS standpoint, we're looking at, until that system is perfect a little bit more. If that antigen test during surveillance is positive, we're going to treat it as positive, even if that PCR does come back negative, but we will do more case investigation on an individual basis to determine. But so far, the experience that I have had working with health services in collaboration with Fulton County Board of Health, because we have contacted them in certain situations where there has been a similar, not necessarily with surveillance testing, but in regards to a positive antigen followed by a negative PCR. We have consulted with Fulton County Board of Health in those specific situations on individual cases. And so far the guidance has been that we would still continue with the isolation and quarantine procedures that we initiated based upon the original antigen results. I'm not quite sure if that helps or not, but I just want to let people know from what we've been doing at APS so far as how we've been continuing with the isolation and quarantine based off of the positive antigen.
Okay. Well, thank you again. And I just have to give another shout out to Dr. Lovett and her team. So thank you so much for being here, and to Dr. Lefkove from Viral Solutions for being here. They are incredibly busy, so we got them for 45 minutes and you got to ask some questions. So thank you so much. Thank you all. I want to I see Wendy on here as well. Wendy is our PTA president, so thank you for being on, Wendy. And I want to thank anybody else. Our nurses, of course, Nurse Oxman and Nurse Ford, Mr. Hudson and Miss Small, who have been on here as well. I see Miss Little, one of our teachers. And I see Dr. Poppins on as well, who is one of our parents, who is also a very big fan of surveillance testing and has been a shoulder to lean on as well. So thank you so much. We will pick back up at 11 o'clock with our virtual learning town hall. If you are a parent of a virtual learner, we've got a lot coming to you. In the meantime, I think it looks like some numbers are being put in regard to how many students on each grade level have consented to testing, if you're interested in seeing any of that at the primary center at least. And outside of that, if there's anything you need, please reach out to myself or our nurses, and have a great rest of your day. Take care, everybody.